We are going to cross now back to the Chris Hani Baragwanath Hospital, where the army have arrived to try and alleviate the strain that is being taken by the healthcare workers as they deal with the COVID-19 infections. Let's cross live to that.
Lieutenant Colonel Semoda, again, you will be another the 2IC in that medical task group team. And then far left is Dr. Mohammed Desai. He is going to be part and parcel of the medical task group. He's a doctor. As you know that in our medical task group, we have nurses, we have doctors, we have paramedics, which we call off medics, which is going to be part and parcel of the deploying team, which is going to be at Baragwanath. Thank you very much.
Thank you, Brigadier General. What I'm going to do is I'm going to ask the MEC for help, Dr. Mukheti, to come, and then all of them, whenever they speak, they'll come here just so that you are able to get the audio. She will give some brief remarks on why we are here and so forth, and then she'll be followed by SANDF afterwards. MEC.
Thank you very much, Dr. Mutale. Good afternoon, Premier, colleagues from the Army, the CEO and the HOD, the two CEOs from the one from Charlotte Mateke and the other one is from Bara, and the HOD of the department. Good afternoon, members of the media. What I want to firstly to say is that I think all of us are aware, or they are seeing that our numbers are increasing every day, and I can also say that our system is also pressured, and we really needed support. We want to thank the Minister of Health and the Minister of Defense for coming to assist us with the HR that you are currently seeing here today. Maybe just to indicate that with the first wave and the second wave, we managed to contain the pandemic. And we managed to contain the pandemic simply because our people of Gauteng were compliant. They were putting their mask everywhere we went. They were always putting their mask, and they were also washing their hands and using the sanitizers. So I don't know what happened. It looks like our people are now relaxing. What we are seeing happening in our communities is quite different from what was happening with the first and second wave. And that is where we are today, because our communities are not complying. But I'm not going to say a lot. I think we are going to take our community of Gauteng into confidence, because there has been a lot of stories that has been said. So today we'll give our people confidence. They will hear from us what are the pressures and what is it that we are doing with it. Thank you very much.
Thank you, MEC. If I can allow from the Defense Force, Brigadier General Maso, to just come up front. The leader of the team.
Good day, everybody. Good day, Premier, MEC, my colleagues and members of the media. I greet you all this morning. I need to say we have been tasked as instructed by the Commander-in-Chief of South Africa and the Minister of Defense and Military Veterans, in collaboration with the Minister of Health, Acting Minister of Health. We have been tasked to come today to be of assistance during this third wave. Yes, we know the third wave is affecting everybody, Defense Force included. But because of the very nature of our work, we have got to support the country when in need. And this is such a time when the invisible enemy is at the door. We can do nothing else but to yield the call to come with a group of professionals, a medical task group which has been delegated and is in progress of being prepared to be functional at the unit behind us all within the next 48 hours to 72 hours, after all the preparations have been in place. Preparations in terms of getting all our members vaccinated, getting everybody to be orientated on the site of where they are going to work, so that Baragwanath can hold the capacity of beds that they need to increase, because we have been told currently they've got 96 beds that are occupied with minimum number of personnel. Yes, we know also personnel get infected, hence we've got to be there to support in terms of relieving the strain on the healthcare professionals of Gauteng. In our group, as General Mkobozi has said, we've got doctors, we've got nurses, and we've got OECPs and ENMC, emergency medical practitioners, who are going to be assisting, inclusive of all occupational health and safety people that are going to be guarding that everything is in order in terms of PPE. Our only weapon that we come with is personnel, the skill that we've got. But that skill is nothing without protective personnel equipment, which we entrust that the Gauteng Health Department will ensure that all our soldiers come and adorned with all the requirements to be able to be functional and combat ready. I thank you.
Thank you, Brigadier General Maso. What I'm going to do is just to allow Premier to come up front and have some remarks, and then we will then go into the Q&A session. Premier?
Thank you very much, the MEC for Health, Dr. Mkheti, the team from South African Military Health Services led by Brigadier General Maso. We are here to welcome you at this facility, which is called the ABT at Chris Hani Baragwanath Hospital. I want to acknowledge the CEO of Chris Hani Baragwanath Hospital and the CEO of Charlotte Maxeke Hospital. Some of the staff from Charlotte Maxeke Hospital are deployed here as well, and that is why the CEO is here and the acting head of department. The first thing I want to say is that our province is under fire. This place is burning with coronavirus. And our message is very, very clear that everywhere around the province, there is no exception, everywhere around the province, the positivity, the test positivity rate is extremely high now. We want to say to our people that the chances of getting infected is extremely high wherever you are. Even in families now, we are getting the information that even in families, people are getting infected or are infecting each other in families. But we will continue to fight, and that's my message. We will continue to fight in this battle to contain COVID-19. We will continue to fight, and the presence of the team from the South African National Defence Force Military Health Services joining us here is a great inspiration. They are trained in fighting on the front of healthcare. This is the first team that is being deployed here. You will understand that they are working throughout the country. They are working even in the facilities of the South African Military Health Services. They are working, but this is the first team that is responding to our request. We went to the minister, the acting minister of health. This is what we did during the first wave and during the second wave. When we feel that we need help from national government, we go and ask for that help. We asked for help during the first wave. The national minister then gave us additional support. During the second wave, we also asked for help. The national minister again gave us additional support. During the third wave, we need more support than we have ever needed before, because you can see for yourselves that the numbers relating to the third wave are way above where the numbers were during the first and the second wave. The infection rate, the test positivity rate, but also the hospital admissions are just doubling up almost every other day. As the Premier of the province, I don't want to send a message that everything is okay. The message must be clear. I know when our officials speak, they try to say things are, I must say to the people of our province that the house is under fire. We will not change this trajectory of the pandemic if we don't do certain dramatic things. We will not change this. Over the weekend, I drove around. Our restaurants are full. You go to the shops, it's packed there. It's not just in the townships, but in the suburbs. You go to the shops, it's packed. People are walking about as if the situation is normal. So I'm saying in the suburbs, the restaurants are full. People are walking there in and out. They are crowding there. And there's some false sense, including those who have already gotten the vaccine, there's some false sense that, well, the situation is normalizing. I must also say that driving around in the townships, I've also seen people are playing soccer. They are gathering there in one of the neighborhoods in my area. A leader of a trade union movement sent me pictures of a big tournament yesterday, on Sunday, a big tournament. And people were playing, watching the tournament yesterday, and people were not having their masks on. So we want to send out the message very, very clear. So I spoke yesterday. Last night I spoke with the CEO of the private healthcare group Netcare, Dr. Friedland, Richard Friedland. He says to me, the private healthcare institutions are full. That message has been out there. They face similar challenges. They face similar challenges with regard to additional staffing. We face similar challenges. So what are we doing in Gauteng province where we have additional beds? And I don't want to send a message that we have lots of beds, because to send that message may be to say to people, oh, it's okay. Every 2 days, there are beds that are filling up in our hospitals. Every 2 days. Yes, the numbers that were released by the department, those numbers are right. But let me tell you, if we have 100 beds today, there's no guarantee that we will have those 100 beds at the end of 48 hours. So the number of beds that we have now, looking at especially the numbers, the increase in infections that have happened just in the last 5 days, those number of beds are regarded as taken, even if they are not yet occupied, because there is a 7-day lag. I regard those beds as taken, all of them. So that's one of the things I want to say to you. Sitting here, I don't want to say to you, yes, there are beds we have elsewhere. In some instances, we have fewer staff in those beds. We have given the department an additional 1.5 billion rands to bring in additional staff and retain those we had during the first and the second wave. The MEC was saying that even those staff are not adequate for the kind of third wave we have. So yesterday, as I was speaking with the CEO of the Netcare group, he was saying to me the issue of additional staffing is both a challenge in both in the private and in the public sector. That is why we receiving the men and women from our National Defense Force is something we really, really appreciate. But I also want to say, even with them, they can't come all of them to these facilities because they have a military health services to run. So we don't have the luxury to think that we will keep getting more and more from the National Defense Force, because they have one meal is one of the institutions, the hospitals in our province. They must look after our soldiers who themselves are getting infected. I am very happy that tomorrow the team that is deployed here is getting vaccinated tomorrow. So you will know that the vaccination program first focused on the first category was the healthcare workers. The second category is those 60 years and above. The military had not yet vaccinated, but they are getting to the front line. As we speak right here, we have 96 COVID patients in this facility. 96 COVID patients. We've got 66 nurses that are from Chris Hani Baragwanath, as well as Charlotte Mateke. And the team from the military health services is going to rotate in groups. They will be bringing a particular number to complement those that we have here. But we would like to make sure that this reinforcement is not only here. We have other facilities. We've got Anglo Gold Ashanti. That facility today was supposed to start operating today. Full scheme. We opened it. There are doctors and nurses who have been deployed there. I was told this morning that there was some group of protesters who were trying to block them there. But we need additional deployments in this. We've got other facilities across the province that have been opened. We have, as I said, we have already contracted over 5,000 outside the staff complement. We have already contracted over 5,000 healthcare workers just to help us deal with COVID. But even that 5,000 that has been contracted to add to the current staff complement is not enough. So what are we doing? So yes, we can do with more healthcare workers in our facilities across the province. I know that unfortunately Charlotte Mateke is not operating, but all the staff from Charlotte Mateke are already deployed in the different healthcare facilities in Gauteng. They followed their patients. So there are no staff that are waiting who are not doing anything. They are in the various facilities. So that when we open Charlotte Mateke, we are able to get them back there. But they are already working in the different healthcare facilities. So my message is, our healthcare system, both in the public and in the private healthcare sector, is under tremendous pressure. The only way we can't determine how many more infections are going to happen. We can't determine that, but the behavior of our people in the communities can help slow down the impact of the pandemic. All we can do is to make sure that we spare no cent, and I want to say that we will spare no cent to make sure we have more beds and more beds and more beds. Last week the MEC met with all the CEOs of our hospitals. All the hospitals in Gauteng have gone back to do what they did during the first wave. They've gone back, and Dr. Friedland told me they are doing the same in the private sector. They've gone back to look at every space and add an addition, where you can add additional beds in an existing facility. We are looking for every opportunity to add additional beds in existing facilities. We are doing this because we know there are still going to be more people, just given the infection rate that is happening now. A week later and 2 weeks from now, more people are going to be admitted in our facilities. And I'm speaking this morning also, there was a meeting between our private healthcare sector and the public health sector. I'm speaking on behalf of both the private healthcare sector and the public healthcare sector in Gauteng. As things stand, the healthcare system is, anyone who thinks there are enough beds anywhere else, looking at the infections that have already happened, I take those beds taken already. I'm not saying there are no beds, but those beds, in 7 days' time, they will be taken. So we will continue to look for more beds, but one of the critical issues, both from the private and the public sector I'm getting, is one of the critical issues is more staffing, because our healthcare workers are under tremendous pressure at the moment. They are under tremendous pressure. And we will spare no cent from the health system point of view. But again, I want to say that if things go on the way they are, if in the communities, both in the suburbs and in the townships, if the restaurants continue to fill up the way they are filling up, if people continue to just go out and organize a birthday party or a party this and that, and let me tell you, there were Father's Day parties. And it may not appear like even if it's just 10 people, where we are with the pandemic, 10 people are 10 dangerous people. Because the prevalence of the virus at this moment is that if you have 10 people, the likelihood is that in that 10, half of them may be carrying the virus. So we are going to need support from our communities. If you were to ask me, do you think this level 3 is working? We have not yet seen the impact and the results of level 3. We have not yet seen it. If what is happening over the weekend is anything to go by, it is not changing behavior. So the healthcare workers will do the best they can, but this battle will not be won by the healthcare workers alone. It can only be won, this battle can only be won if we start seeing less movement, we know there are people who go to work, those we understand, they travel at certain times. Those who go to work have to go to work. But just the general level of mobility in the province is not giving a sense that people are aware that we are at a very dangerous moment at this point in time in the pandemic. So I once more want to appeal to the people of our province that this pandemic, even those who are vaccinated, need to put on their masks. This message is important because those who are vaccinated think they are out of the woods. Not yet. We did a one-dose vaccine. Most of the people is a one-dose vaccine. So thank you very much to the team from the military health services. But we need more and more support. And I say to our national government, any kind of support that the province will be given, we will welcome that type of support. We will welcome that type of support, but we need, this is in the hands of people in our communities. The infection rate is much, much higher than we have ever seen. We have breached by more than 2,000 what the peak was. We are not yet at the peak. At least from the team that's doing research for us, we are not yet at the peak, but we have already breached the highest peak of The second wave was 6,900 daily infections. We have already breached that by over 2,000 already. It is possible that in the next week and the week after, these numbers may still be going up. And when the numbers come down, they come down very slow. I want to emphasize that. Even if we can start seeing the numbers coming down, they come down very slow. And sometimes when the infection rate comes down, the hospitalization continues to increase 3-4 weeks after the numbers go down. So that's why the health services is our primary critical concern at the moment. The health services are going to be under pressure for a long while. I must say that we have been doing everything as the provincial government around making sure that that additional facility called Charlotte Maxeke is open. If you were to ask me, given where we are, if you were to ask me, I would walk in there tomorrow and open Charlotte Maxeke. We have looked at everything. We have taken legal advice. We have taken everything else. But getting over all those processes is too slow. Standing here, I feel like walking into Charlotte Maxeke tomorrow and opening it, even if there are areas that the city of Johannesburg has pointed out as needing attention. But given where we are now, definitely that's what I feel. That we should walk into Charlotte Maxeke and get it, because the additional Charlotte Maxeke is not about additional staffing, because those staff are already working. But those additional beds we need at Charlotte Maxeke. And every time we get to a point where it's like it is sorted, we are going to get the bed, we are going to open a certain section, and then they're always back and forth about technical issues related to the engineers and those who are approving. We, as I said, given the where we are with the pandemic, if things were according to me, I will walk in there into Charlotte Maxeke tomorrow and open the areas that the report, the engineers have said the fire did not affect those areas. I know everybody every day is calling, please open Charlotte Maxeke. And I definitely want to do that. In fact, I actually want to camp in there. It's my hospital. And I need to say it is my hospital. I go to Charlotte Maxeke for consultation for long COVID, something that's called long COVID, which means lingering symptoms of COVID. I haven't had consultation at my hospital, Charlotte Maxeke. So those who are feeling that the hospital should be opened as of yesterday, that's where we are. But there's always issues of, in a country like South Africa, there's always issues of rule of law. You can't do this, Premier. That's what the lawyer said to me, Premier. You can't walk in there and get the hospital opened. Certain things need to be sorted out first. And the reality is that we are making this call. We briefed the minister to say we need every facility in Gauteng to be available for us to deal with COVID. So this house is burning. We have to douse the fire. And part of that is a function of what is happening in our communities. Right there. And I want to emphasize, both in the suburbs and in the townships, across the board, across color, across class, people have just abandoned the compliance with the requirements. And this is very dangerous. We are in a very, very dangerous place called Gauteng right now. It's not safe at all for anybody even when you are at home, it is not safe. So let's take extra measures. Let's do anything we can to make sure we overcome, and we can only do so together. Thank you.
Thank you, Premier. I think what we're going to do now is that we're going to go into the Q&A session. What I would request colleagues from the media is that show of hands, and then I'll point at you, and then from then on, when your turn comes, the normal, introducing yourself and the media house you represent, and the question that you want to ask. If a question has already been asked, can we then get into the next question so that we don't have to take up the space that others could be utilizing? I will do it this way. I think I saw 1, 2, 3, okay, 4. Someone Nagago. Who else? Okay, there's 4 hands for this. I'll allow the second round then which goes, okay, I apologize, I didn't see you. It's 5. So I've got 5 hands now that have been raised. If I can allow in that order, to introduce yourselves, and then you raise the question, and then the principals will be able to respond, I think, once the questions have been raised. You can start.
Good afternoon. I'm Griselda Lewis from SABC Television. Premier, perhaps I'd like to know exactly, or even from Brigadier General Maso, how many exactly, total number of military medics are going to be deployed in the province. Perhaps you could also give us details about how many here at Chris Hani Baragwanath Hospital first, and then provincially, exactly how many military medics will be deployed in the province. The second question, if I may please, just let my mind talk.
Okay.
Maybe that was good then. Thank you very much. It's Zianda Ngobo from Newsroom Africa. Just to add on to my colleague Griselda, perhaps if you could also just tell us how much is being spent to actually deploy the military across the province. And Premier, I hear you saying that we're level 3 and you're not yet seeing the impact. You obviously do consult with the Coronavirus Command Council. Will you be calling for tighter restrictions in light of what government's been telling us, that you have an adjusted and approach, a differentiated approach, I should say, across the country? Our situation is obviously very different to the other provinces. So will you be calling for tighter restrictions?
The third hand, yes.
Thank you so much, Scopin from ENTA. I'd just like to find out, Premier, will the medical health services only be stationed at public hospitals, or will they be going to private hospitals as well? You have said that you consider the beds that are currently available to be taken because of the rate of infection and what is happening over the next 5 days. So are you saying that the hospitals in Gauteng, both private and public, are full? And what happens in 5 days to the people who require hospitalization? And then, Premier, how many beds are at Charlotte Maxeke right now that would be added into the available pool if you had to open it? Okay.
Sorry, I just remembered my second question. May I? Thank you. My second question, Premier, was that what is it, you had discussions with the public and private sector. At what capacity are we as the province now in terms of fullness, in terms of the COVID wards? Are we at 70, 80, 90%? Where are we? And also, are you considering the field hospitals? Will you consider reopening those field hospitals?
I actually had a question.
Sorry, no, I'm not going to allow that. But you see, colleagues, if we are going to ask for discipline, let's discipline among ourselves. Because I think now we are disturbing the order, because other colleagues also have got questions. Rather, I'll come back to you if you've got the second follow-up question. That is not right.
Premier, my question is in regard to the criticism that has been leveled against the Gauteng government. My name is Sepo from SABC. That you have 96 people already hospitalized here out of a capacity of plus minus 500 beds. Whilst you have people, we are told, that are waiting in chairs with the hospital supplements, waiting for beds. So some people are saying that this will be like a white elephant. Why don't you bring people, into this facility, unlike them having to wait days for beds, whereas you have this wonderful facility that is almost empty.
I don't have the left hand here. Sorry? You're covered. Okay, the first part. Okay, let me allow the principal to respond to the question, then we'll come to the second part. I think the first question was directed at colleagues from the SANDF. If I would allow Brigadier General to respond, you can step forward.
All right. If I may say, when we say we deploy a number of soldiers, we deploy soldiers in task groups and task teams. The numbers cannot be displayed to the public, but a task group can nurse at least an average of 60 to 100 patients. But because of rotation of shifts and the fact that we are supplementing an already existing organization, we cannot then say how many patients in ratio of how many personnel. But we are deploying a medical task group which is consistent of 60 people in the interim. But that 60 is not the actual number, because other people in that group are doing some other duties like occupational health and safety, checking that people are donned on and off. But the healthcare professionals in the teams are an average size to assist and supplement the staffing ratios of this hospital. 6-0, the first.
Okay, I don't know whether it's Griselda. Charlotte had 1,068 beds. From the 1,068 beds, we had 490 beds that were dedicated to COVID. 490 dedicated to COVID. And then we had 49 plus 15 ICU beds. I hope that answers your question. And then with regard to where we are, I think it's Griselda who asked that question. Yesterday we had 1,470 patients admitted in public sector, and then in the private sector it was 3,448. Total of patients admitted in the hospital in Gauteng, including private and public, it's 5,280. And then with regard to capacity, when we count COVID positive patients, we are sitting at 40%. Remember, we have that electronic bed monitoring dashboard, which is live. Every time you discharge a patient, you admit, it calculates. So where we're sitting now, we are at 40% COVID patients admitted. And then when you include the PUIs plus COVID, we are sitting at 72%. 72% patients admitted in Gauteng as we are standing here. Thank you very much.
What's the PUIs? Explain.
The PUIs are patients under investigation. So those are the patients that come into the hospital and they still need to be tested whether you are positive or you are negative, so that you can be directed to a correct facility. Thank you.
Okay. I just want to start with that. We have a lot of COVID patients who are persons or patients under investigation, and they take a lot of beds. So what are we doing to deal with that? So what is now the minister, in support of the challenge we are making? The minister was here a week ago. We were here with the minister. We're now using antigen testing. So the antigen testing will help us clear. So there are people who are waiting to know whether they are positive or negative, but they are occupying beds that are needed for only those who are positive. Let me give you an example. I did an antigen test this morning because we were with the mayor of Johannesburg. You know, yesterday he released a statement that he tested positive, and we wish him well. So because we were together with him 7 days ago here, when he released a statement, I was advised by our team, including the health department, that Premier, even if it's 7 days ago, it's important, even if you don't feel anything, that you must. So I did an antigen test. In 20 minutes, I got my results. So, and that's why I got my results. What does that do to the healthcare system? So we are working with the National Health Laboratory Services. We want to clear a lot of the beds that are occupied by PUIs, people who. So through antigen testing, we will be able to know that the actual number of people who are COVID positive who need medical attention, or those who are now sick. In other words, there's been a progression into not just asymptomatic, but they need treatment. So one of the things we are dealing with is just clearing those. So the testing process. So our teams that are doing testing are going to clear most of these beds. So in a sense, she told you the numbers. When you take out those who are patients under investigation, you have a bit of space, but I still want to warn. So the question that was raised by you, Govan, it is true. So in a week's time, those beds may not be available. Given the numbers that are there, what else? So the first intervention is clearing the PUIs. So that intervention is happening everywhere across the province. The CEOs of the hospitals have been told that cleared through antigen testing. The second intervention is using every available space in our current hospitals to create additional beds to take care of COVID patients. This was done during the first phase. It was also done during the second phase, and it is being done now. So the beds that we have now, is it a waste? If you understand what the fact that they may, and that's why I don't want to emphasize the story that we have enough beds, because that story, if you look at it accurately, that story is going to change. The beds, even the number that we have here, the critical thing we want to do is to ensure that we have sufficient staff that will be able to manage all the wards here. And I don't want, so the story that this is a waste, and the story that we have enough beds may be a different story in 2 weeks' time. So we would like each one of the wards that are here, each one of the beds that are here, we want to make sure that we will go at great length that those are there's available. There's the beds here. You have the technology. Everything is installed. We just need to keep increasing staff. And we have been having this discussion with private health. Let me tell you what our approach is. When we're dealing with the pandemic, the distinction between the private and the public health sector is something we put at the back. These are people who need medical attention. So if there's additional capacity in the private sector, we work with the private sector to use it. And at the moment, they are doing the same. Again, the CEO was saying to me, they are doing the same to create additional beds. But we said, if they don't have additional beds, we have additional beds. Let's share this burden, because it's about saving life. Because all these are people who need medical attention. If they have additional ambulances, let's share the resources. Where we have resources, let's share, and that's something that we have agreed. Wherever there are additional beds, and at the moment, as we speak now, these additional beds are there. But I am cautioning that in a week's time, those additional beds may be taken. And as more people now test positive who are PUIs, those people who are PUIs because the clearing PUIs is important, but if more of them are testing positive, it means they are occupying those beds as well. So I don't think anyone can say that there's been oversupply of beds. What we need is additional human capital. At least in the province, you are asking a question. So if you run out of beds, will you go back to not level, Nazareth? This question was asked to me in 2 different meetings. And I want to answer it that way because I believe it's correct. When you deal with the pandemic, you can never say never. When you deal with the pandemic, you have to say, even things that you may have thought, different provinces made different provisions before. During the first wave and during the second wave, we had NASREC utilization. We were criticized. It was said to be a waste. NASREC utilization was very, very small. We had PUIs there, over 300. At the most, we had about 350 PUIs. And we had much fewer people who were actually getting treatment. It was said to be a waste. We said it is not a waste. We better be safe and have more beds. If you say to me, will you go to that extent? I said to the team at Health when they said, but we were criticized. I said, never say never. When we are dealing with a pandemic, and when we see that what we have is not adequate, especially after losing the number of beds, we will do everything. Government, we will do everything. And I'm saying that even with the resources we have at Health and in the provincial government, we will do everything and scrape whatever resources to make sure we have more provision. But this wave is outrageous. You can see it's like a raging fire. So we will do everything to make provision. But it's a function also of what happens from now with regard to the pandemic. So I don't want to rule that out and say we will not. You remember, this is when people talk about field hospitals in Gauteng, this is another type of field hospital, but it is not the one you set up and dismantle. We've got another type of field hospital like this. It's not dismantled afterwards, it's going to be used. We have that at George Mukari, we have that at Jubilee. So those additional capacities, again, when we look at the behavior of the pandemic, in 2 weeks, we might not have those beds. So we would like to work with our national government to say, let's take whatever measures, additional measures, to prepare for way beyond where we are now. Okay, in terms of levels, tomorrow we have our provincial coronavirus command council. Tomorrow, that is Tuesday afternoon. The provincial command council will do an assessment. Will we recommend more restrictions? Sitting from where we sit, all of us, anybody can see that the COVID pandemic in Gauteng is really raging, and I can't say that what we have done is enough. So I can't rule that out, that we may need more restrictions, but it is something that's going to be discussed. One of the things we are doing, we're also having a discussion with religious leaders. On my way here, I was also having a discussion with the liquor traders, the coordinator of the liquor traders. So we are talking to everybody. I said to you, We're talking to the private sector until late. Last night, the CEO of the Netcare Group who's coordinating. We're talking to the liquor traders today. Tomorrow, we are also talking to the religious leaders. So we are basically trying to rally everybody behind one message. The pandemic is completely out of control. And if we have to do extraordinary things, if we have to ask for further restrictions above level 3 in Gauteng, if we have to do that, it's something that we must explore. In other words, we must do everything to really, really bring this pandemic under control. But it is something that will be discussed. I also had a discussion with the acting Minister of Health on my way here about what else can be done. And we will come back to the National Coronavirus Command Council after our meeting tomorrow. The reality is that if these numbers are sustained, and it is likely that they may be sustained, something needs to happen. If these numbers are sustained, and even after they come down, it takes extremely long. It takes at least 2 to 3 weeks to start seeing a big difference in the hospitalization in that way. So, Gauteng province is in a very difficult space. So if it is possible to ask for a level higher than the others, the pandemic here, the infection, we have been hitting above 60% of the national daily infections. We are, I think today, yesterday, the last 24 hours, 62% of daily infections. If we look at the average per week, so we are contributing way between 60 and 70% of the infection rate. So will it be good for the rest of the country? Let me tell you how the pandemic behaves. If the numbers are if the infection rate is happening as it is, the next set of provinces that will be hit hard are clearly those that are connected to Gauteng organically. Where people are moving in and out of Gauteng, and we know which provinces are those. Those that have already passed through this heat, like Northern Cape, Northwest, Free State, they were ahead of us in the infection rate, but Limpopo, Mpumalanga, KZN has, the traffic flow between KZN and Gauteng is huge. When they were feeling the heat as the coastal province during the second wave, we were expecting it to happen when people come back from the festive season. And we were helped by the introduction of the alert level 3 in December. It helped us a great deal. So I think we answered all your questions. The deployment of the military is a function that gets carried out by national, so we're not able to really say to you, we are only grateful that the military health services is deployed here. So they get deployed anywhere in the country. They are a national service. They are not a provincial service, so we can't be able to say to you how much, but we are very, very grateful. But we are going to continue to search for more resources, especially the human resources. We are going to continue to do that. As I say, we will not spare a cent to ensure that we respond adequately. But something also needs to happen drastically. In the suburbs and in the townships, we need to see that the restaurants are not packed as they are now. And we need to see that the shops and the football grounds are not packed as they are now. Even if it's for a short while, to make sure that we slow down the pandemic, something needs to be done. What that something is what we will discuss tomorrow at our Provincial Coronavirus Command Council meeting. And of course, the final decisions lie with the National Coronavirus Command Council. But as things stand now, we have to do everything, guys. And I also need to say to you, please be safe. We need you to report to the people about what is happening, but we also need you to be safe. And I didn't talk about vaccination today at all. Remember, as we are dealing with this, there's the vaccination program stepping up that. We are going to be focusing on the teachers from Wednesday in our province. We will be starting with the teachers from Wednesday. They are going to be a critical focus. Look, I am also very concerned about the schools. 20 schools were closed last week, but it's 20 out of more than 2,000 schools. And the infections were about 1,900, but it's out of more than 2 million learners in our schools. So yes, we are monitoring what is happening in our schools, but it is important that we don't also overreact to a situation that the advice may be, the scientists may be saying to us that these learners are safer in our schools. But if we hit a period where the infections are many in our schools, we may have to consider. The good thing is that some of the schools, the public schools, are closing. They are going to go on a holiday. It is something that we will consider. But I want to say that every single bed we have here and anywhere else is not a waste. Every single bed as things stand is going to be needed. And every single bed as things stand at the moment, in a week or two, those beds are going to be critically needed. Of course, there are people who are also being discharged, who are recovering from the pandemic. But you might notice that the recovery rate of our province is lower now than it was at some point. We don't want to bank on recovery. We want to make sure that every bed that is available can be utilized. So please be safe. Let's get the message out there that people can't be moving up and down as if it is normal. If it means we need some more significant, higher level for a specified period, tomorrow we are going to consider that. Thank you so much.
Thank you, Premier. I think looking at the chairman where we are now, I'm going to end it here, and then we are around if colleagues would need maybe clarity on anything, so that we just maybe clarify. Maybe there's a number that is mentioned that is not here properly. We'll be able to assist you with that particular figure. But thank you very much for coming through, and then let's keep on engaging. Premier, MEC, Brigadier General, and colleagues, very much. We're ending it here.
Well, a very good afternoon to you if you've just joined us. This is SA Today with me, Unathi Batyashe. While that was Premier David Makhura just wrapping up that press conference. As you know, personnel from the military health services are being deployed at the Chris Hani Baragwanath Academic Hospital in Soweto as we speak. As you know, that Gauteng is the epicenter of the pandemic, with those increasing numbers and rising numbers in the province. Some have called the province a crisis and are calling for the provincial government to increase somehow the level of restrictions that we are currently in. But we'll have to find out and see what comes out of that command council that is going to be taking place tomorrow. We understand that the Premier will be attending that, where certain decisions will also be made. But we will get reaction on the press conference and also some of the measures that have been introduced in the province. But perhaps let's continue with the COVID-19 angle that we are tracking for you this afternoon with this. The National Institute for Communicable Diseases says the coronavirus test positivity rate in the country has climbed further to 23.7%. Now, this